Today we are going to talk about facial nerve palsy. There are two types of facial nerve palsy, unilateral and bilateral. Usually we find unilateral facial nerve palsy. Sometimes it is called Bell's palsy, but it's commonly common mistake that Bell's palsy and facial palsy not synonymous. Bell's palsy is one of the cause of lower motor type of facial nerve palsy. We know facial nerve is the seventh cranial nerve, and the seventh cranial nerve is located in the pons. The brainstem has three parts: midbrain, pons, medulla oblongata, and then spinal cord. This is the midbrain, pons, medulla oblongata. The nucleus of the seventh cranial nerve is located in the pons, actually the lower pons or pontomedullary junction. And here is cerebellum located posteriorly, and there is a cerebro-CP angle, cerebropontine angle. Two cerebrum, left and right, and two nucleus on the respective side of seventh cranial nerve, facial nerve, located in the lower pons. We know the facial nerve nucleus has two parts, upper part and lower part. The upper motor fiber that innervate the upper part of the facial nerve comes bilaterally. Cell body here present in the cerebral cortex that innervate the upper part, and also another upper motor neuron coming from the opposite cerebral cortex and innervate the upper part facial nerve nucleus, and lower part only innervated by the opposite cerebral cortex cell body and join the lower part of the facial nerve. Upper part of the facial nerve nucleus supply the upper face, and lower part of the nucleus supply the lower face. Imaginary line going through both the canthus of the eye divide the face in upper part and lower part. The upper part of the face supplied by the upper part of the facial nerve, and lower part of the face supplied by lower part of the facial nerve nucleus. Lower part of the nucleus only innervated by the opposite cerebral hemisphere. So the lower part of the face will be paralyzed. Now the upper part of the nucleus innervated by the both cerebral hemisphere. If there is any lesion that damage the upper motor fiber coming from the left side, then the upper part of the nucleus is still getting the supply from the same side of the cerebral cortex. So upper part of the nucleus also can still supply the upper part of the face. So in upper motor type of palsy, facial nerve palsy, only the lower face of the opposite side is paralyzed, and upper part of the face is not paralyzed. Now, if there is any lower motor type of lesion from seventh cranial nerve nucleus to the stylomastoid foramen anywhere in its pathway, then what will be the manifestation? If the lesion involves the lower motor fiber of the facial nerve, then both the fiber coming from upper part and lower part of the nucleus are damaged. So both part of the face will be damaged, will be paralyzed. Now what will be the feature of upper motor type of facial nerve palsy, and what will be the feature of lower motor type of facial nerve palsy? At first, upper motor type of, it is said that in case of upper motor neuron lesion of facial nerve, only the lower face is involved and upper face will be spared. If we ask the patient to wrinkle his forehead, he or she, the patient will be able to wrinkle his head. Then if we ask the patient to close his or her eye, the patient will be able to close his or her eyes. This the upper face is normal. And in lower face, try to show his teeth, the mouth will be deviated to the opposite side. If we ask him to blow or puff his mouth, he will not be able to puff his face or blow. And for inspection, we will find that the loss of nasolabial fold and drooling of the angle of mouth on the same side. All these are the features of upper motor type of nerve neuron lesion. Now, in case of lower motor neuron lesion of 7th cranial nerve, what will be the feature? All the features that we have found in upper motor type of neuron lesion, plus the patient will be unable to wrinkle his forehead as well as unable to occlude or close his eyes, and total paralysis of the same side of the face. Now, what are the causes of 7th cranial nerve palsy? As a upper motor neuron lesion, stroke or CVD, any tumor or mass that causes damage the upper motor neuron lesion coming from the cerebral cortex to opposite side of 7th cranial nerve. What are the cause of lower motor type of 7th cranial nerve lesion? As we know, the 7th cranial nerve is located in the pons, lower pons of the midbrain, and it traverses through the facial canal and exit through the stylomastoid foramen. So any lesion from the 7th cranial nerve nucleus to the stylomastoid foramen can cause lower motor type of facial nerve palsy. The cause of lower motor type of 7th cranial nerve palsy. The most common cause is a Bell's palsy, trauma to parotid gland, such as surgery, trauma to base of scalp, acoustic neuroma. Then sarcoidosis, middle ear disease such as chronic suppurative otitis media, cerebrovascular disease involving the pons, and any neoplasm in pons, parotid tumor, herpes zoster, herpes zoster. Now another thing to understand here, if there is upper motor type of facial nerve palsy involving the cerebrum that causes facial nerve palsy to the opposite side. There also the hemiparesis of the opposite side of the lesion. If the lesion on the left side of the cerebrum, then there will be the right-sided upper motor type of facial nerve palsy plus hemiparesis of the right side, as because the descending motor fiber coming from the cerebral cortex run in the internal capsule, and those descending motor fiber may also be involved that cause the opposite sided hemiparesis and upper motor type of facial nerve palsy that involve the lower face. Now, if there is any lesion that involve the 7 cranial nerve nucleus located in the pons, may involve the descending motor fiber going through the pons. So any lesion involving the 7 cranial nerve nucleus may cause hemiparesis of the same side. So if any patient having any type of facial nerve palsy, we must examine the patient for hemiparesis by plantar response and deep tendon reflex. If we see the patient has upper motor type of facial nerve palsy and same-sided hemiparesis, then we think any lesion that might located in the opposite cerebrum. And if we find a patient with lower motor type of facial nerve palsy that involve the hemiface, the hemiface with ipsilateral hemiparesis, then we might think any lesion that may be present in the pons. Thank you.